And Dr. Henry, in BC, we've learned that hundreds of people have tested positive since having at least one dose of the vaccine. I'm wondering if you also happen to know how many people may have died after contracting COVID-19, even if they've had the vaccine, and, you know, if that falls into your expectations. And just wondering, you know, are you worried, or is the data showing you anything in terms of what does this mean possibly for second doses?
Yeah, so obviously that is something we're watching really carefully, and we have linked information, linked data of cases and immunization that we're following on an ongoing basis through the BC CDC. And we have had, as you say, about last I checked, it was a couple of days ago, there were 400 and some cases of people who were 14 days post-dose 1 who developed COVID. So that is 0.07%. So a very low rate, which is good news. And that's probably an overestimate because people may have been in their incubation period before they had full benefit from the protection of the vaccine. But we want to be conservative on that. And we've had several dozen, it's in the 30s, cases of people who have tested positive, become for COVID at least a week after dose 2. So that's 0.04%. So very small rates compared to what we're seeing from similar communities or similar transmission events in the community where it's much, much higher. The protection is long-lasting and very good from the vaccine. That's great. I'm not aware of any deaths in people who have been immunized and developed COVID afterwards, but I have not had the latest numbers. I know that my colleagues in the immunization program at BC CDC are watching that on an ongoing basis. There was one death in a long-term care home after immunization, and a person who was over 100 years of age.